Meantime, digging more into the issues that we are seeing in terms of tax revenues around this coronavirus pandemic. Of course, there have already been concerns about funding Social Security, but due to the drop in tax revenues lately, one model is indicating that the funding issues for Social Security might be moving up for years, depending on the way you look at it. And for more on that, I want to bring on Yahoo Finance's Kristin Myers, who has the details. Kristin?
Afternoon, Zach. Yes, so we're talking about everyone's favorite model, the Penn Wharton Budget Model. They actually decided to check what the impact of the coronavirus pandemic has had on Social Security, which I know is of great importance to pretty much everyone. So just to start off on the baseline, so according to the trustees report just from last month, April 2020, they said that the fund was going to be depleted by 2035, 15 years from now. Now, according to the budget model's own modeling and projections, they actually had a little bit of positivity there. They said the fund actually had just another year of life left to it, and that the fund would be depleted by 2036. Now, I know you mentioned when that fund would be depleted. I'll get to that in just a second, but I want to talk to essentially the hits that the fund has been taking because of the pandemic. So one, we've been having hits to revenue pretty much for three reasons. One, loss of jobs. Two, lower interest rates, which of course is going to reduce the interest income that the fund is going to earn. And three, because of a long period of low inflation, we hear Brian Chung talking about that a lot, that also is going to be reducing earnings for everyone, and therefore the tax revenue that the fund is going to pull in is also going to be decreased. But this is all going to be offset by the costs that the fund is going to be paying out. Unfortunately, obviously, a lot of people that we've been talking about that have died from this virus are elderly, people that are either near or at or in retirement. So that is obviously going to decrease the amount of money that the fund needs to pay out. And the cost of living has also decreased. So that's going to be an adjustment there to the benefits that people are going to receive when they decide to apply for Social Security. And thirdly, the initial benefits claimed at retirement are also going to be falling. That's because of these two reasons. One, there's wage reduction over the course of your life. If you've been hit during this course here, during coronavirus, after you apply for retirement, how much you've earned has been changed. And two, a reduction in the average wage index. Now, the fund kind of indexes to that index there, so that's going to change the amount of benefits that you are going to get. Now, you guys all just heard Greg was talking about the kind of recovery that we're going to be having. A V-shaped recovery is kind of a foregone conclusion. That's unlikely to happen. However, if we did have a V-shaped recovery, as you can see, the fund would have been depleted by 2034, so 2 years earlier than what the Penn Wharton budget model was projecting. If we have that U-shaped recovery that Greg was talking about, much longer tail of a recovery, that fund that gets depleted, Zach, 4 years sooner, 2032, 3 years prior to what the Social Security trustees said, and 4 years prior to what the Penn Wharton budget model was projecting. Either way you slice it, however, the clock is clearly ticking on the Social Security fund, and when those funds essentially are going to run out. So unfortunately, a big hit that the fund is going to be taking here because of the pandemic, Zach.
Yeah, and just amazing to think about. I mean, you talk about a lockdown that's really only lasted a few months here, and just the impact that has over time, and obviously shutting down the economy for a length of time, whether it's just a matter of weeks or months, does add up, and important to highlight there, especially in a program as important as Social Security. But Kristin Myers, appreciate that.